I'm gonna blow it.
In April, because of the circuit breaker measures in Singapore, we moved our sessions to an e-learning platform for about 1.5 months, where our team of therapists had Zoom sessions with Jamie twice a day, each session for 2 hours. When we prepped getting him to learn through this platform, initially the novelty of it was exciting for him, but it was hard for him to sustain his attention to learn through the iPad screen. And as the circuit breaker went on, because Jamie had to stay home all day, we started to see more behavioral challenges. He did have lots of interests across different play activities at home, and he was able to engage himself meaningfully most of the time. However, he was having more frequent tantrums due to 1. Not getting what he wants, and 2. Not wanting to stop playing with a toy. When Jamie first started sessions in the clinic, we had worked on his tolerance and compliance to terminating preferred activities during his break times and coming to the table to start the lesson. However, he wasn't generalizing the same behavior at home, especially when his therapists were just in a little iPad screen and not there physically to follow through with their instructions. This wasn't easy for Jamie at the start, but by moving up the phases very systematically and being very consistent with our behavior criteria, Jamie soon realized our expectations of his behavior were the same in the clinic and at his home too, and his therapists were able to achieve much better compliance. The first phase we started with was we terminate his break time, he comes over to the table, and all he had to do was one quick instruction that he was very likely to comply to, which is what we call a high probability instruction. And then he was rewarded with going back to what he was playing with.
Y Z.
Alright.
We get it.
Time's up, my friend. Can you clap your hands? Good listening.
All done.
All done. Do you want to watch the video again or do you want to play a bus?
Bus.
Bus? Okay, go ahead. You can go get a bus and play on the floor, okay? Go ahead.
When he didn't listen, we followed through with our feedback and he was able to shape up to it.
The time's up. Come sit down at the table.
I already know. I want to know.
Hey, you didn't listen. Come sit down on the table.
I see me.
Wow, good listening, buddy. Beautiful listening.
All done.
Do you still want to play with the bus or you want to see this video?
Play bus.
Play the bus. I love you using your words. Go ahead.
Eventually, we increased the number of instructions he had to respond to and also included instructions or questions that were neutral in preference, so that it would be a bridge to his learning programs.
Okay, all done. Okay, time's up now. Blankets on the floor. Good listening. I love you sitting nicely and nice hands, buddy. Gonna give you the Sorry, hands on your lap, please. There you go. All right, excavator. That's right. Okay. That's good hands. All right, we're gonna check out this book. It's about the boy getting a haircut. Okay. See, he needs to go for a haircut because his hair is so long. Look, the daddy is combing the hair. Very good hands. Well done. Good listening. It's still sitting so nicely.
All done.
All done.
So now Jamie was much more willing to come back to the table after every break time, but he was still getting very upset when he couldn't get what he wanted. For example, during the session, either the helper or his mom or dad would be in the room with him, and he would very frequently ask them for chocolate or to play with the dog or to go onto the bed or watch TV. And if they were to say no, he would throw a big tantrum. So the next program we worked on was his tolerance to denied requests, and a big focus was on the transference of skills to his parents and helper, so that they would be able to manage his behaviors better. What we taught Jamie was when we say no, he should say okay, and we would sometimes reward him for saying okay by giving the item we initially denied. The times we don't reward him for saying okay, we would instead give him other instructions, and if he were to comply to do it, we would either reward him with the denied item or something else. The reason we taught him to say okay is because it's a visible behavior, rather than simply staying calm and not doing anything. It is also socially acceptable to say that when someone says no to you. And lastly, it is also easier for the child because they can focus on what to do rather than what not to do. Let's take a look.
I want helicopter.
I want helicopter.
Wow, I love you talking nice, but sorry, no.
Okay.
Wow, good saying okay, buddy. Nice and cool. You can have the helicopter. There you go.
Okay.
Good boy. Nice and cool. Saying okay.
So in this clip, Jamie was learning to say okay with a visual prompt of the word. And what you'll see in the next video is the therapist not having to prompt him to say okay anymore, and also being able to increase the number of instructions he has to listen to after he says okay.
Yummy. Wow, check that out. Super yummy.
I want chocolate.
I want chocolate. I love using your words, but no.
Okay.
Good saying okay. Can you tell me what is this?
Car.
Car. And what color?
Red.
Very good listening. We're gonna drive the car. Vroom, 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 vroom. Good listening and press the horn. Beep, beep.
Beep, beep, beep.
Very good listening. Next one, what do we have?
Train.
Train. Train goes. Choo-choo. Good listening. Ready? We're gonna pretend to be a train. Chugga, 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 choo-choo. Good listening. You know what? I love that you said okay and you listened to me. You can have a piece of chocolate. Wow, there you go.
Now the circuit breaker is over and we're able to resume sessions in the clinic. So I'm looking forward to sharing another update with you about Jamie in a month's time.